I've been involved for over 15 years supporting research as a lay patient and carer. This patient, sorry, it's enabled me to actually bring my voice into research projects, which was really, really important for me because I saw quite a lot in my life with my friends and family where things went right and where things went wrong, and the voice to me was really important because it helps researchers to shape, design and support that research with having real life experience and involvement. So the next couple of slides, because the PRA role is relatively new for the Trust. It's based at the Bradford Institute of Health and Research. We have a wonderful team, Karen, Jane and Tracy, that support the PRAs. And it's a role that's twofold for me because it's going to help and support, we're going to help and support research teams as well as support public patients, the public that come through and use these services. We're going to highlight and ensure that they know what research is happening within the Trust. So I'm going to go, the next couple of slides are just going to give you a flavour of what a PRA role will entail and what we can do for the teams. Wanted to start off with a definition of patient research ambassador. The PRA role is someone who promotes health and social care research from a patient's point of view. He or she can be a patient, service user, carer or a member of public. What do we need? Why do we need PRAs? Well, we need PRAs for people using local health and social care services to raise the awareness about research, its benefits and its opportunities. We're also here to ensure that the public and patient voice is represented in research studies and teams. That's really, really important. Now, how can we get involved? A key part of our role is to share our experience of being part of research as patients, public or healthcare professionals. And how is it done? So I've listed a couple of activities. We can become representatives of a committee or local involvement in groups. I'm actually involved also and set up the patient group for the Bradford University. So we have 35 to 40 service users and carers who support research within the university. I've also chaired the patient safety for the Bradford Institute of Health and Research and member of the Improvement Academy. So our voice is there in different arenas and those networks we're able to bring as PRAs into the Trust. We also help to commission research, so we can review proposals from the light bulb idea all the way up to dissemination. We raise awareness about research by speaking at events. I was at an event last week for the National Institute of Health and Research, and there we raised the Bradford Trust PRA role within other PRAs who were involved there from Bradford, Sheffield, Leeds, Nottingham. So we're able to say we've established this role in Bradford and how we can network with other people. We work with researchers and patient groups to identify important questions, which was, the questions that you may think, well, can this question become a research project? So we're there to bring that lay perspective. We have been involved as co-researchers. We've carried out interviews, analysed and interpreted results. There are PRAs in other trusts who are a little bit advanced in embedding their role. They've actually now got involved in research roles and they're actually leading research and making bids as a lay member, but got the researchers to actually support them. So it's a really wide role that we're able to support the team. We also get involved in clinical trials. We can be part of interview panels for the Trust. We contribute to the training of new research staff. to support the quality of research and promote patient public involvement, so we could be on panels, bringing in the lay perspective of recruitment as well. We review research reports to help make sure the public can understand them, which is really important. At the Hospital Trust, we've established so far 4 PRAs. We are recruiting all the time, but we've started the project in April. We've attended various meetings with researchers within the trust to try and map out how our involvement and how we can support the individual teams, which is really important. We have spoken, as I said, recently at the Yorkshire and Humber event. We've established networks with other PRs, so we work closely at the moment with the Leeds PRAs, seeing what's best practice and how we can develop and shape our role here. We are panel members at strategic level within the trust. We're not just grassroots or a tick box exercise, which PRAs are really conscious not to be. But at the trust, we've been involved at every stage where we sit at the strategic level, where we sit at the Trust Research Committee, and our voice is embedded at every place where we know that we can help and support the trust. We attend the monthly Trust Research Nurses meeting, and that gives us an insight of what's going on and how the research nurses feel. We have an action plan, we have objectives, we're supported, as I said, by the team and by the trust, and also by the Institute of Health, where there's new projects, if they need any research lay support, we're also involved in that aspect. So it's a fairly new role, but the foundations are there, and it's really to emphasise today that we're there. We are here for you. We're here to, as well as empower patients and public that come through the doors of the trust, we're here to support all your projects as well. Thank you.